So welcome back. This time we're going to discuss Chapter 11, covering the reproductive system. So by the end of this chapter, in this lecture, you should be able to look at any complex reproductive term and decipher its functions, anatomical location, and pathology. We'll cover structural terms, disorders, diagnostic tests, and surgical interventions for both male and female systems. Let's go to the anatomy and function. So before looking at the words, look at the geography. Notice how closely the reproductive organs sit next to the bladder, urinary bladder, and rectum. This explains why reproductive disorders often cause urinary and gastrointestinal symptoms. Also pay attention to the layers of the uterus. So you have the perimetrium, outer layer, meaning around, the myometrium, which is the thick muscular layer, meaning muscle, and the endometrium, which is the inner lining, endo meaning inside. Remembering these three anatomical layers will help you with pathophysiology section. So we're going to look at that, and that shows the fallopian tubes. So we'll go over some of the terms. Gonado means gonads. These are the primary sex organs, testes in males, ovaries in females. Their dual job is to produce gonite cells and sex hormones. Gonado refers to the organs of reproduction or genitals. Spermatozoa versus ova. Notice the singular suffixes. One, spermazoon or ovum. So crucial distinction here. Notice that some organs have more than one combining form. Vagina can have the combining form of vagino, that's Latin, and also colpo, which is Greek. If we look at the vagina, we also use vagino. So if you do surgery on it, we often use colpo, which is colpoplasty, as an example. The uterus has three forms. Hystero, often used for surgery like hysterectomy. Utero, which is structural, and metrio, referring to the tissue layers. Ovary has ovaro or oophore, pronounced oofero. So the uterine tube or the fallopian tube is salpingo. So you can think of the tube shape. Cytal, the suffix meaning killing. So you can think of spermicide kills sperms. Meno means month. This represents the monthly menstrual cycle. Plasia means development or formation. Cysto versus vesico both mean bladder. This comes into play later when reproductive structures drop or push into the nearby urinary spaces. Amno or amnio refers to the amnion, the thin layer protective membrane surrounding the developing fetus. Nati means birth. Neonatal equals new birth. Prenatal equals before birth. Para and para means to bear offspring. A para is a woman who has successfully given birth to a viable infant. Just look at the female system. We have multiple options: orchio or orchido, which is Greek, or testo or testiculo, which is Latin. Prostato, the prostate gland. Vaso means vessel or duct. Specifically in this system, it denotes the ductus deferens. So if you say vas deferens, the tube that carries sperm away from the testicle. Here's a little knowledge check. And time for a brain break. Go into diseases and disorders. Let's decode some of these. All of these end in rhea, flow, discharge, or ragia, which is bursting forth, heavy bleeding. Amenorrhea is without a month, which is that monthly cycle. And rhea, which is flow, literally meaning no monthly flow. Dysmenorrhea is painful, difficult. Meno, month, which means menstrual cycle, and rhea, painful monthly flow. Menageria is meno, month, plus ragia, which is hemorrhage, abnormally heavy, prolonged bleeding. And metrorrhagia is uterus plus ragia, hemorrhage, bleeding from the uterus occurring between regular cycles. Remember that itis always stands for inflammation. So when you have colpal plus itis, colpitis means inflammation of the vagina. When you have endometritis, you have inflammation inside the uterus. Salpingitis is inflammation of the fallopian tubes. And then you have the Ophrynsalpingitis. Wow, that's a mouthful. Which is inflammation of both the ovary and the tube simultaneously. So the suffix osis means condition. So with endometriosis, you have endo, inside, plus metro, which is uterine tissue, plus osis is condition. So that means tissue similar to the inner endometrial lining grows outside the uterus. The suffix seal means hernia. So with salpingocele is a protrusion of the fallopian tube out of its place. Cystocele is cysto-urinary bladder plus cele, hernia. The bladder weakens and bulges backward into the vaginal wall space. Myoma is myomuscle and oma, which is tumor mass, specifically a benign tumor growing in the smooth muscle wall. And the myometrium of the uterus, clinically, these are called uterine fibroids. So crypto means hidden, plus orchid, testicle, plus ism is condition, literally a condition of a hidden testicle because it failed to descend into the scrotum before birth. Orchitis is inflammation of the testicle. Ectopic pregnancy is ec or ecto, meaning outside. The fertilized egg implants outside the uterine cavity, usually inside the narrow fallopian tube. Abruptio placenta. Abruptio means to tear away, and the placenta prematurely breaks away from the wall of the uterus. So these are just some more general terms for STIs, sexually transmitted diseases. And so with this one, you have an overgrowth of Candida yeast fungus. Even though it causes vaginitis, it's not strictly an STI because Candida naturally lives in the vaginal biome, but can overgrow. The combining form for breast can be masto or mammo. Dynia or algia means pain. Therefore, mastalgia or mastodonia and mammalgia are all interchangeable terms for breast pain. Ptosis means drooping or sagging. So mastoptosis is breast sagging. So here's a knowledge check. And now we're getting into diagnostics and interventions. So gyneco is female plus logist, which is the specialist, equals specialist in female health. Obstetricians, the root word comes from the Latin for to stand before, assisting in birth. Tubal ligation. Ligation means tying off. This is a surgical sterilization where the fallopian tubes are cut or bound. When discussing gynecological procedures, a hysterectomy is the foundational removal of the uterus, built from hysterec, row, uterus, and ectomy, which is to take out. It is performed via minimally invasive abdominal incisions. And the term laparohysterectomy adds the root lapro, which is abdominal wall, to specify the surgical approach. So for adjacent structures in orif, so ovary, to denote removing the ovaries, while the salping, the fallopian tubes, for tubal removal. These roots are modular and stacked together when removing both sutures simultaneously. Finally, a colonization of the cervix describes the removal of a cone-shaped wedge of tissue from the cervix, serving as a cone biopsy to both diagnose and treat cervical precancers. We check out cervical suffixes using the root orco, testicle. You can remove the, you have ectomy, which is removal. You have plasty, which is surgical repair, pexy, which is surgical fixation or anchoring, and then also tomy, which is incision into. And we have okay. When looking at the suffix raphy, it means surgical suturing or repair of a tear. So suturing up or a tear or weakness in the vaginal wall, which is exactly how we repair a cystocele. Dilation and curettage, which is a DNC for abbreviation, dilating the cervix, and scraping, that's the curettage part, the inner endometrial tissue lining. So a transurethral resection of the prostate, which is abbreviated as a TURP. Trans means across or through. Urethral means the urethra. A surgical tool travels through the urethra to cut away obstructing prostate tissue. Notice with the TUMT, they use a microwave, and the tuna uses a needle ablation. This uses physical energy sources to destroy extra tissue. And here are just some other reproductive and hormonal therapies. You have abbreviations IVF and HRT. So with gestation, the period of pregnancy is broken out into trimesters, 3-month periods. Ante means before, and partum means childbirth. So you have antepartum. Post means after, plus partum. Childbirth means postpartum, after. The gravata and parasist system. Gravata counts every single pregnancy, regardless of outcome. Prima gravata or gravata means first pregnancy, and para counts only the number of pregnancies that are reached viably. Nullipara, nulli meaning none, means a woman has never given birth to a viable fetus. Unipara equals once. Okay. So when discussing prenatal diagnostics tools, we begin with the ultrasound, which uses the components of ultra, beyond, sun, sound, and graphy, which is the process of recording to visualize the fetus and pelvic organs using high-frequency sound waves. During pregnancy and labor, clinicians utilize fetal monitoring to track the fetal heart rate and uterine contractions to ensure ongoing fetal well-being. For early risk assessment, the UltraScreen protocol combines a maternal blood test with a specialized nuchal translucent ultrasound to screen for chromosomal abnormalities. If definitive genetic testing is required, providers perform invasive sampling either through amniocentesis, which uses amnion, and centesis, surgical puncture, to extract amniotic fluid via a needle. So when we look at tomy, which means incision, you have amniotomy, which is an artificial incision or rupture of the amniotic sac to induce labor, commonly called breaking the water. Episiotomy is an incision into the perineum to widen the vaginal opening during pregnancy, childbirth, and delivery. So mastopexy combines masto, which is breast, plus pexy, which is fixation and lift. It's a surgical lift to treat a drooping breast, which is mastopetosis. Mammoplasty is mammo, breast, plus plasty, surgical repair, and includes any plastic surgical procedure that alters size, shape, or position of the breast. Okay, that was the same thing. So we're done. Try to switch up how you study in order to support retention. Use the exercises in your Google Notebook as well as those linked with your textbook.